It's a miracle. It's honestly nothing short of a miracle.
Tonight, a story of survival. A young 35-year-old Edmond mother suffered a massive stroke. Doctors at Mercy tell us at first glance, they had little hope she would survive, leaving her husband and 2 young boys to prepare for the worst.
But in a miraculous twist, not only did she live to share her story, she's thriving. News 4's Emily Akins with the survivor story.
Early morning feedings were the norm for Chris Gomez. The mother of boys, Lucas and Oliver, are her whole world.
I woke up with her making noises, like she was trying to move.
One February morning, she woke to feed her infant, and her world turned upside down.
I turned the lights on, and she was clearly having a stroke because the right side was paralyzed. She couldn't see anything.
Edmond 911, what's the location of your emergency?
I need an ambulance at my house. Her face is kind of turning.
You think she's having a stroke?
I remember him saying, I'm going to call 911, and then I remember the IMSA guy standing over my head.
A 35-year-old woman having a stroke in the middle of the night.
There are neurons that are dying millions a second.
She can't move her right side. She can't speak. Onset was within an hour ago. She's a brand new mom, and it's like immediately you just go into super high alert.
Dr. Bahar Malakouti knew right away survival was no guarantee for this patient. Paralysis was inevitable.
How can we prepare the family for if things go worst case scenario, which was a real possibility with her?
The blood clot starving her brain of oxygen left Chris with no function on her right side, no speech. She couldn't even understand words. Dr. Malakouti dosed a clot-busting medication, a first line of defense.
In a 30-something-year-old woman who has a toddler and a 3-month-old baby and a loving, doting husband, clearly a very full life, it was so difficult for us.
Dr. Brian Van Zant removed the clot, a harrowing procedure that would be Chris's only chance at a normal life. But they discovered a second clot out of reach.
Kind of left the rest of it up to God and said, you know, here, we've done our part. We've done everything we possibly can for her, and let's see how she does.
And the next day, that second clot was gone. Chris Gomez fought her way back from death's door, and she did it in record time.
It is by far one of the best cases I've ever done in my career.
Just 2 weeks after that life-altering stroke,
I am here home.
she walked through the front door, back to her babies, back to the life she almost left behind.
When she came back home from the hospital, I was just super happy.
I had a stroke. I had a stroke.
Chris knows the grueling work getting back functions stolen by stroke.
I told God that it would be easier if I just died, and I was fine with that. I thought it would actually be too hard for me to have to come back to home, to the family, with my deficits. Say hi.
She's a speech pathologist serving stroke patients just like her.
I'm hopeful that I'll have some opportunities to serve that population in a way that probably nobody else can. Have this experience to really know what it's like.
These days, every day is a gift. She's forever grateful for her life-saving medical team and for her young son and that early morning feeding.
Saved my life because we wouldn't have known.
Chris Gomez is forever changed.
If someone had told me before, you're gonna have a massive stroke and you're probably gonna die, maybe, before, I would have thought, I cannot handle that. But I did, and I'm stronger for it.
Forever a medical miracle. Emily Akins, Oklahoma's News 4.
Wow, that is awesome. Chris is on track to regain all of her speaking ability, and she's praying for full feeling in her hand, too.
She says she's grateful to her new family at Mercy, which, by the way, is a comprehensive stroke center. Doctors reminded everyone to look out for signs of stroke, and the most common being drooping facial features, sudden loss of balance and speech, and loss of strength in arms or legs.